Dr. Buchert here with Mint Health. So today I'm going to go over briefly why it's super important to approach your mental health like your brain is actually connected to the rest of your body, because it's not separate. And the way that your mood is changing and processing is really intricately connected to all of your systems. So that's why it's super important to consider that in your treatment plan and how you approach your health. So just like I tell patients all the time, your menstrual cycle is a messenger telling you that something else is wrong. It's not coming out of nowhere. Same thing for our mood. So PMS, PMDD, anxiety, depression, perinatal and postpartum mood changes, and the mood changes that come throughout perimenopause and menopause are all messengers about things occurring through our whole body systems. So one reason it's great to be able to work with a functional medicine provider as part of your team is because we acknowledge all of these things. Now, I will tell you, as a physician, I believe and know that prescriptions are incredibly useful and important, especially whenever there is a crisis situation or very bad diagnosis or a situation. So we don't want to be afraid to use those things, and I certainly encourage people to continue with psychiatry or send consults, because we want everybody on board to do what you need. However, if we only follow the status quo of just jumping straight to, oh, you have this mood problem, here's the prescription, we miss so many opportunities to improve the health of your whole body, as well as give you better results and much more long-lasting results. So what are all the things to think about? Number one, don't ignore it and blame yourself. So many people come and tell me all the time, people are just telling me I'm moody, or I just don't feel like I can treat people the same, and they're just blaming themselves and feeling guilty rather than really seeing it as a mood change from their whole body. There's so many things that come into play: genetic vulnerabilities, triggering events, very, very important, and that especially happens with adverse childhood events, how they affect our health, perinatally, and the hormone changes of menopause and perimenopause. There's actually some great studies that show intervening with bioidentical hormone replacement therapy in perimenopause can actually prevent lasting depression through menopause, which does go up much higher for women. Insulin, blood sugar, thyroid, hormone levels, all of these things cannot be ignored, and metabolic changes are huge in how the cells in your brain function. And if you are ignoring that, you're really missing the boat on improving your happiness by helping your mood. Our HPA axis, our hypothalamic pituitary adrenal axis, our cortisol awakening response, the cortisol diurnal rhythm, sunlight, sleep, all of these things are critically important when we're thinking about how to have a happy life by resolving these kinds of issues. Mitochondria and cellular energy production, intestinal permeability and inflammation, very, very connected, and if we ignore this, we're also really missing the boat. Our nutrition and nutrients, and then of course the common things that we think of, things like cognitive behavioral therapy, trauma-informed therapy, and prescription medications when we really need those. So takeaway is you really want to assess the whole picture. If you present to a physician with mood changes and the only answer is here's your prescription, there's so many other things to be addressing from a holistic perspective. And then we want to take all of the results that we have to really personalize your plan. Even if you're taking a prescription medication, which can be super useful, you want to be working in all of the other areas at the same time, and things don't change overnight. So it's really important to be committed, to be consistent, to be very thorough with your approach, so that you can also see your health transform, not just with your mood, but in many ways over time. So that's our pointer for today. We look forward to working with you.